Welcome to this video. Now, I've had lots of complaints from people that they are still suffering from the signs and symptoms of COVID-19 infection, sometimes weeks or even a month or two or more after they've started with symptoms, and saying, well, what is going on here? And up until now, we haven't known too much about this, but we are in a position now to put together a certain amount of information to give us more of a sort of a complete picture on the clinical spectrum of disorder that people are suffering from when they get COVID-19 infection caused by the SARS coronavirus type 2. So we've called this signs and symptoms. Now, we've said this before. A sign is something that you see as the examining person. A symptom is something the person complains of, and together these are called clinical features. So the first one is, how long does COVID-19 last? This is a very good question. And this is all sprinkled with references. So if you want to spend hours reading through this yourself, you're more than welcome to do so. Now, what seems to be emerging from the COVID-19 symptom tracker app, on about 3 million people reporting into that, 1 in 10 are sick for 3 weeks or more. So people that get sick, 90% are feeling a lot better after 3 weeks. But 1 in 10 are still feeling sick for 3 weeks or more after first symptoms. So generally speaking, COVID-19 is a short-term illness caused by the SARS coronavirus type 2. That's fairly accepted. Normally it's short-term. Normally short-term. And most health sources, when you read most websites and information on this, people will recover within 2 weeks. So the vast majority of people that are becoming symptomatic are recovering within 2 weeks. But some people report symptoms from 3 weeks to months. And I've had a lot of people emailing me saying, I've had this for a month or 2 months now and I'm still sick. What is going on here? Is this COVID-19 or is this some other disease? So again, plenty of background reading for you there. So 10% still have symptoms after 3 weeks. So it's a fair proportion. And some may suffer for months and really be quite unwell for months. So if you are in that position, I think you can be reassured to some extent that at least you're not alone. And this is becoming a recognised problem, a recognised phenomena. Now, some experience fatigue, headaches, coughs, anosmia, which is the loss of smell, of course. I think most people know that word now, anosmia. Sore throats. Delirium is kind of a mental confusion. And chest pain for more than 3 weeks after their first symptoms. So these can be ongoing symptoms that people are complaining of. So 3 weeks after they get first symptoms, they're still tired, they're still headache, still coughing, still can't smell, still sore throat, still not quite with it mentally. It can go on. But a pattern is beginning to emerge now, and it's starting to look much clearer. So in the minority, and thankfully it is the minority that have severe cases. In severe cases, the symptoms typically follow a characteristic pattern. Not always, but typically. So the loss of smell and the fever and the cough are typically in the first 2 days of the illness. Now, yesterday we did look at data showing that anosmia can occur in any phase of the illness, but it's most common in the early stages. So the loss of smell, the fever, the cough in the first 2 days, that is fairly typical, as discussed in this reference here. But in people that do get more severe illness, this is in the people that get more severe illness we're talking about now, in that minority that gets more severe illness, these symptoms, the anosmia, the fever, the cough in the first 2 days, can develop into severe respiratory symptoms, often needing medical care after about a week. So if people are going to deteriorate, typically, as we've known actually since February, it's likely to be in the second week in people that develop more serious illness. Can even be delayed longer than that, of course. Now, in milder cases are more likely to have a variety of strange symptoms. And in the milder cases, so we're talking about milder cases now, these unusual symptoms tend to come and they tend to go over a more extended period of time. So if we have this sort of deterioration in the second week and the respiratory difficulties, the breathing difficulties, that's really what we're describing there, the more severe cases that need to see a doctor and need to go to hospital, or potentially need to go to hospital. But the milder cases, the symptoms seem to come and go. A variety of strange symptoms that come and go, often over an extended period of time. And this has been quite alarming for people. People have often emailed me and said, look, I was ill for a few days, then I started feeling better, but now I've got diarrhea, or now I've got a headache again, or now I've got shortness of breath again. And it's quite alarming, because you think you're getting better and then these symptoms seem to rear their ugly head again. But this now seems to be indicative of more mild disease, with a less likelihood of developing the severe respiratory features that are the life-threatening, the main life-threatening component, not the only life-threatening component. So two sort of presentations there, really presenting the more severe that might need hospital care, and the milder with those characteristic evolutions of the illness. Now, Tim Spector, of course, King's College London, he's the lead academic in the King's College Zoe app. As I say, with about 3 million people reporting into him. He says the more we learn about this virus, the weirder it gets. Now, this is not me. This is the big professor talking here. So, if he finds it weird, what are you and me going to find it? Certainly weird. And again, Professor Spector saying, I've studied 100 diseases. COVID is the strangest one I've seen in my medical career. So that's saying something from a guy who studies this kind of stuff as his day job, and has done for many years. So still a lot we're learning about it. So symptoms in longer term COVID, the ones that don't resolve where it becomes longer term. Cough and high temperature, of course, we're familiar with those. But then there's a wide range of symptoms as well. And these can often be GI is gastrointestinal. That's the mouth all the way through to the anus, the gastrointestinal tract, or the digestive system. And symptoms can also affect the cardiovascular system. And the cardiovascular system is the heart and the blood vessels. So both the digestive system and the circulatory system can be affected as well, with a wide variety of potential symptoms. And again, plenty of reading if you want to click on the link. Now, so-called atypical symptoms, very often in milder disease. Now, they're called atypical, but really they're not really that atypical, because they come up quite a lot in milder disease, but they're still called atypicals. They're not shortness of breath, they're not fever, they're not cough, they're not loss of smell, they're other symptoms that people complain of. And these so-called atypical, the symptoms that are not typical, as we've just described, do tend to come and go over a period of time. But as we've said, that looks now like it's a characteristic of milder presentation. Now, this is Rachel, who reported in a lot of detail to Professor Tim Spector's group. She's an academic herself, so Dr. Rachel Pope. She said it started out like a cold or a flu, so that's how it started. By week 4, most of the people around me who had it as well, including my daughter and former partner, got better, but she wasn't better. And this, of course, is very demoralising, because, you've got people around you who got sick at the same time as you. They're better, but you're not. So she was still not feeling well at all after 4 weeks, by week 4 of the illness. Now, Rachel went on to improve during a fourth week. So she must have thought she was getting better then, but then she got worse again in the 5th week. So very demoralising that this seems to be a protracted course. And you can read up some other people who suffered the same sort of things there, where she thought she was getting better and then she got worse again. And I know a lot of people listening to this will be able to relate to this sort of relapsing and remitting almost type of clinical symptomatology. And then in Rachel's case, the symptoms move from her airways into the internal organs. Now, this is more alarming, of course. resulting in heart problems that took her to the accident and emergency department, or the emergency department. And the first time they thought was having a stroke, and the second time they thought it was a heart attack. So here we see that Rachel's been suffering from brain problems, in that they thought she was having a stroke. So perhaps she had disturbances in her speech, or one side of the mouth was down, or the face was down, or there was a weakness on one side of the body that would indicate that she may be having a stroke. And the second time they thought it was a heart attack. So both very alarming conditions. Now, the heart problems aren't well identified. Now, I actually knew about the heart problems way back in February from reading early reports from China, because there was patients who developed troponins in their blood. Now, in the heart, you have all these contractile muscles, these muscle cells that contract, these myocytes that contract. And inside here, you've got these contractile filaments, and these contractile filaments contain troponin. It's one of the parts they contain. And normally, the troponins are kept inside the membrane of the heart muscle cell, the myocardial cell, the myocyte. It's normally kept in there. But if the cell's damaged, then the troponins can leak out, and they can be detected in the blood with blood tests. So that's an indication of damage to the heart muscle, myocardial damage, where we have these troponins that are detectable in the blood, indicating heart damage. So I've known that there could be some heart damage for some time, but then again, they can be in viral infections. But anyway, these heart problems, so there are heart problems, that's documented. We've known about that for some time, and Rachel's doctors in A&E thought she was having a heart attack at one stage. And this seems to be caused by post-viral inflammation. Now, again, we've known about this for a long time. There's particular types of virus. Classic one is called Coxsackie virus, for example. And when someone's infected with that virus actually damages the heart muscle. These cells are actually, some of them are even killed by it, or they can be killed by viral infection. And that leaves an ongoing inflammation and damage in the heart. So are these heart problems caused by post-viral inflammation rather than ongoing infection? Well, from what we know about other diseases and post-viral diseases of the heart, that looks probable. So it may well be that in the 5th week when Rachel was having these problems, she was no longer infectious, but there was ongoing inflammation as a result of the infection that she had, that presumably her immune system has cleared already, and she's now suffering from these inflammatory side effects. And we noticed this just a couple of days ago when we looked at detail on the drug dexamethasone. And dexamethasone, we know, improves the probability of people living if they're on oxygen support or if they're ventilated. It improves their chances quite significantly. And the dexamethasone is an anti-inflammatory drug. That's what steroids do. They are very, very powerful anti-inflammatory drugs. So they seem to be working by combating the inflammation, not so much caused by the virus itself, but caused by the body's immunological reaction. As the body tries to use the immune system to clear the virus, we get this inflammation as a result, mediated by the cytokines, of course, these chemicals that transmit the messages from cell to cell. And if you get lots of cells releasing lots of cytokines all at the same time, that can cause a cytokine storm, which causes this severe inflammatory reaction. So is it something like that? We know that goes on in the lungs. So is it something like that that's going on that's affecting the heart rather than ongoing infection? Well, the answer is probably, but we're not entirely sure yet. So at the moment, this is, to be quite honest, it is a bit of a worry. Now, it's important to emphasise this is just patients that do get complications, and it's a vast minority of patients. But of course, if there's millions of people all over the world suffering from this, then that could add up to a lot of people, unfortunately. So what am I worried about? There's some early indications that some people, and again, I stress it's the minority, so I don't want you to get too worried about this if you've had this illness. But there is indications that there can be lasting organ damage as a result of these immunological inflammatory reactions to the virus that affect the lungs. I've spelled it wrong. It can affect the lungs, the liver, the brain and the kidneys. So again, in this illness, there's been suggestions that there can be long-term lung damage. Again, the liver releases these enzymes that we can test for that go into the blood that indicate liver damage, possible brain damage and possible kidney damage as well. So all fairly concerning possible long-term complications. But at the moment, there's no evidence for the prevalence of these. We don't know how common this is. It's looking like it's not very common, but we don't really have this information yet. And this damage could explain the ongoing symptoms in the 3rd, 4th, 5th, 6th, 7th, 8th week up until several months that people are complaining of. So it could well be that these people have cleared the infection, the immune system has cleared the infection. To be quite honest, that's what you would expect. But they're still suffering and they're still not feeling well because of ongoing symptoms caused by ongoing inflammation. So that's the more likely explanation. But we don't actually have the data to give a definitive answer on this. So that brings us on to this. Our COVID-19 long-termers, people with a longer-term illness, still infectious? Now, initially, we thought that if people were still symptomatic, then they probably are still infectious. And that's the safe thing to go with at the moment. So that's kind of the safe thing to think. So if people are still developing, still have symptoms, particularly respiratory symptoms, it's safe to assume that they're still infectious until they start testing negative. So normally we say that if people get symptoms on week 1, they shouldn't be infectious. On day 1, they shouldn't be infectious by day 7 or 8. So normally that would be the time that people would be infectious for, but if people persist with symptoms for longer, it may well be that they have not cleared the infection. If it goes on for longer still, it may well be that it's the inflammatory reaction caused by the immunological reaction to the infection rather than the infection itself, or it may be that it's different in every case. Maybe we won't be able to come to general principles on this. We don't have the relative percentages. We don't have that data at the moment. Ongoing infection or damage that persists after the immune system has cleared the virus, so that is certainly a possibility. And we know that this happens, as I've said, in many other types of viral infection. Now, Rachel again, I personally think there was still a viral tail up to week 11. So obviously Rachel's had viral infections before and she must have still felt virally by week 11. So this is a long time. So she thinks she might still be infectious. And the reason for that is, and this is after 11 weeks, you've got to feel really sorry for this lady. I was still having quite violent diarrhea at that point, so I think it was still viral. So violent diarrhea after 11 weeks. So I really do hope you're feeling better now, Rachel. That's an awful long time to have it. But Rachel's feeling was that she was still infectious. Now, of course, the ideal thing that would have done is the diarrhea would have been tested. And that would have given more definitive data. And then if we get a group of people, a cohort of people who still have diarrhea after 2 or 3 months, and that diarrhea consistently tests positive for the presence of the virus, then we would know that Rachel's hunch was correct. But at the moment, we simply don't have that data. NHS advice. NHS advice at the moment, National Health Service in the UK, so probably reasonable to follow this all around the world. Continue to self-isolate if you have a temperature, runny nose, sickness, diarrhea, or loss of appetite. Even if this has been more than 14 days since your symptoms started. So the NHS information here is thinking that yes, you could still be infectious. So the majority of people are going to clear the infection by 7 days, but a minority, according to the NHS here, are probably still infectious after 2 weeks, after 14 days, if they still have the symptoms, if they still have these symptoms. Temperature, that's a high fever, a fever above 37 degrees centigrade, above 98.6 degrees Fahrenheit. Runny nose, sickness, diarrhea, or loss of appetite, even if it's been 2 weeks. Now, nearly finished this session now. People with long-term COVID-19 are struggling to get back to normal life. This is Professor Tim Spector again. So quite a lot of people who've had COVID-19 for 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 weeks, these so-called long-termers who get longer-term disease, are struggling to get back to normal life. It's hard work. They're still tired. They're still symptomatic. So these people may be going back to work and not performing at the top of their game, which is fairly obvious. Even with an influenza, and you can feel pretty knocked off, what I call just feeling not quite right, pretty knocked off for some time afterwards. And this certainly seems to be the case with a proportion of people that develop COVID-19. Tim Spector again, there is a whole other side to the virus which has not had attention because of the idea that if you're not dead, you are fine. Now, the average people, and especially many employers, divide the whole world into two groups of people. Those that are sick and those that aren't. Simple as that. You're either sick or you're not. And I know this myself. I've been off sick, maybe with an influenza, or you're off sick with something or other. And you go back to work, and if you're back at work, people expect you to be 100%, and they just pile work on you as if you'd never been away, but you might be feeling a bit ropey and just struggle to go back that day. But people tend to think that you're either, and this is even in the health service, I've had this working with nurses and doctors. If you're back at work, that's you. You're back at work full stop, and you're expected to do full duties. And sometimes it's really difficult. So this simplistic idea that you're either sick or you're not, when in actual fact, there's a whole spectrum in between. In the old days, we used to have this concept called convalescence, and it took a while to convalesce from an illness. And that seems to be sadly missing in our performance-orientated employment sector in so many countries at the moment. So we maybe need more things like phased returns. Or in the army, they used to have the concept of light duties. People could return on light duties. And that concept just seems to have been completely lost, at least in my experience. As soon as you go back on the door, as soon as you put your scrubs back on, or you go back in the classroom, they expect you to be 100% again. And sometimes you're just not. So it's a false dichotomy. And Rachel reinforces this. She said, it's great that we haven't died, of course, obviously, but I have been suffering with serious health problems for 3 months now with very limited support. So we see that many people get asymptomatic disease. Many people just get very mild features, but there are this proportion, 15%, that get really reasonably ill with this. About 5% of those become critical. But of that 15% that become symptomatic, then most are better within 2 weeks, but not all. 10% are still ill after 3 weeks, and a minority go on and don't recover for a longer period of time. Sometimes with relapsing and remitting, they'll feel better, then they'll get worse again. And the big unknown that we have, and it is a worry for the minority, it's going to be a minority, but it is a worry, and a big worry I have at the moment is what proportion of people who get COVID-19 are going to be left with some residual damage to the lungs, the heart, the kidneys, the liver are probably the main things that could be affected. And at the moment, we simply don't know that. But that's a bit of an update. Remember that some people can be long-termers. Many of those go on, we hope, the vast majority of those we hope are go on to recover. But there's a lot of things we still don't know because this is a novel virus.